Thank you very much. I'm here to expose myself. I'm not going to sing or dance, but I'm going to try to speak about what I know. First of all, thank you very much to the organizer, especially all the ALPS team, and we're here because of them, so thank you once again very much for the organization of this conference. So today I'm going to talk about how we can use psychedelics for exposure therapy, and this is the plan. A quick reminder of what is exposure therapy in terms of CBT, and how could psychedelic-assisted psychotherapy be useful in the exposure therapy paradigm. And at the end, I'm going to present a case report of a patient that I exposed under a psilocybin. So briefly and simply, what is exposure therapy? It's been mainly used in CBT, in cognitive behavioral therapy, but in fact, when you do psychotherapy, you expose your patient to some new thoughts, some new actions, and things like that. But if we go to the core of exposure therapy, it's really the repeated and systematic exposure to feared stimuli. And we have several ways of expose people. We can expose people, obviously, in vivo, expose people to situation, to objects, to places and people. We can expose people by sensation, interoceptive. When people have panic attacks, they can expose themselves to heartbeat or to shortness of breath, things like that. And we can also expose people by imagination. And in the former talk, you had a lot of examples about that. You can expose yourself to images, memories, good feeling, bad feelings. And you can also expose people in virtual, means in virtual reality. I think there's an example here. So what are people exposed to? Schematically, to 4 types of stimuli. Animated stimuli, I mean, this is the common phobia, people that are afraid of animals, but also people, like you're afraid of thieves, spiders, snakes, dogs, and so on. You can be afraid of inanimate things, lightning, germs, earthquakes, to situation, like public speaking, obviously, but going to swimming pool, outdoors, things like that, and what we saw today about PTSD, it's thoughts, memories, abuse, trauma. So what makes people be afraid of? Normally you're afraid of things that you have to be afraid of, like a dangerous situation. But people that develop phobia, they're afraid of situations that actually are not that dangerous, and they overestimate the fear. And one thing to understand that is the equation of fear, and I find it very useful with patients. So when you do this equation of fear, the feeling of dangerous threat is the multiplication of the consequences of what's going to happen, the probabilities of it, cross the imminence, and you divide it by your perception of self-efficacy. So if someone is really afraid of butterfly, and butterfly phobias exist, maybe someone has it in the room. If you do the equation of fear, someone who is really afraid can think, okay, it's going to kill me now. It's 100% sure, and I won't be able to do anything. Obviously, this is exaggerated, and normal thinking would be butterfly is harmless and peaceful. And even in the case if he attacks me, I think I can beat him. So most of the time, the people are thinking about their fear. If you imagine, for example, people who have OCD, when they touch here, they say, I'm going to be sick, I'm going to have AIDS, it's going to be now, and I'm going to die. So we have to expose them to that's not going to happen. So what is traditional exposure therapy is to go progressively from the less feared situation to the worst. Normally, we do this in a gradual settings. Research has Also shown that you can also expose to different settings, but I'm not going to go really widely in all the different way of exposing therapy. I'm just going to focus on the one who is, I think, useful with psychedelics. But this is some sort of list on how to do, and you go progressively. So now I'm going to speak about psychedelics and anxiety. And as you know, psychedelics has a really promising effect on anxious disorder. I'm not going to do a review of literature, but just showing you two brief studies on that. We have study on animals, and this shows that obviously if you give psychedelics to animals, in terms of fear, what happens, the psychedelic did not improve performance in a spontaneous alternation task, means rats exploring things, so they continue to explore, but it reduced anxiety-like avoidance behavior in labyrinth. So that means for animals, they continue to explore and they make it in a less anxious state. Is it also working in human? The Lichty team and Friederike Holze did a study on the effect of LSD on anxious disorder. It was not only terminal anxiety, like people being anxious while having cancer, but also severe anxiety. And as you can see in this treatment study, we have good effects on anxiety after LSD assisted psychotherapy. So the idea is to boost exposure under certain substances. It's not a new idea. It's been already done. And substance boosters exposure treatment has been done already. You have several candidates. We're going to see that some candidates are better than others, but you can think of every molecule that change the way you apprehend things. Of course, when you're under alcohol, benzo, beta blockers, but also they try to do corticosteroid or cyclosporine. So there's been a bunch of substances that has been studied for exposure therapy under substances. So if you think about alcohol and benzodiazepine, well, alcohol, it works, there's inhibition, but of course, side effects are big, and you don't want to propose exposure therapy under alcohol. Benzodiazepine, we'll see it works, but it just diminishes the feared stimuli without changing things. And these are some examples of bad exposure therapy under alcohol. So you obviously have this inhibition, but it doesn't work quite well. A better candidate might be beta blockers, and there's a lot of studies about being exposed under beta blockers, and in some situations it works. It really works better for people that have cardiovascular symptoms of the fear. For example, when your heartbeat goes up, and when you have this, it works because you don't. It reduces your cardiovascular, your physical symptoms, but it doesn't change the way you apprehend the fear. So studies have shown that it, in fact, only reduces the physical perception of anxiety. But for some people, it's useful to be in an environment that is stressful without the physical things. So it's one of the substances that work. So now I will speak a bit more on why exposure therapy could be good under the effect of psychedelics. You're going to see my pictures are going to evolve around mushrooms and elevators. It's because the case report is someone's going to be exposed in an elevator under psilocybin. So that's why I'm not obsessed about elevators and mushrooms. So how psychedelic could help in exposure therapy? So you might all know how psychedelic works, but what is really important in exposure therapy is really this imbalance between the decrease of the integrative processing and, on the other side, the increased sensory processing. So when you're under psychedelics, you have this decline in connectivity between associative area, and decline in the integrative process. So how that could help? It's because people that are fearing something, it's always the same. I'm going into this place and it's always the same thoughts you have. I'm going to be in this elevator, my heartbeat going to raise, and I'm going to die from a heart attack, for example. So if your integrative process is different, or if you start to think differently, then obviously you're going to have some new thoughts about this environment. And if you couple this with the other main effect of psychedelic, which is increasing the connectivity between the sensory areas of the brain, so it increases the processing of sensory information, then everything that you're going to feel normally when you're in a frightful situation is going to be completely different. It might be amplified, but what we'd like to see is that it's going to be different. We hope it's going to be something different. So what we want, for example, people that are afraid of birds, if we use traditional therapy, and I mean here pharmacotherapy like anxiolytic or beta blockers, we're just going to reduce the perception of the fear, but the fear in itself, it won't change. What we'd like to achieve with psychedelic is not to reduce the amount of the fear, but we really want to transform the fear in something that is different or more acceptable. So that might be one of the theories how it could work. Okay, I would love to have this bird, but. So what are the theory on the effectiveness of exposure therapy under psychedelics? There's not much research about it, so it's all supposition, but you're going to see that for some patients it might work. So as I said, the classic substances, they just attenuate the fear. I feel less, but I perceive the same. And under psychedelic, obviously I will change my perspective with the psychedelic effect of alteration of my feelings, perception, emotion, and I'm going to interpret things and integrate things differently. So what we really want to have is an anxiety-provoking situation under psychedelic, and that the people really think, okay, this is something completely different. So if we go further in exposure therapy protocol and what works, there's interesting articles about the Kraske team who shows that there are several things that make exposure therapy works, and I'm going to present them and how it could work under psychedelics. So we have the one wherein red are going to be shown how it could work under psychedelics. One of the main way on how exposure therapy works is the violation of expectation, difficult to say. It means that when a people is waiting for something to happen, and people who are afraid, who have phobias, they always expect the same thing to happen. And what is effective is that something completely different happens. That if this guy is persuaded that he's going to die in the plane, the more he thinks that and the more he sees that something different happens, the more it's going to be useful. And then we're going to see the other variables that are useful in exposure therapy. So how violation of expectation could work under psychedelic? Because as I said, normal exposure in an anxiety-provoking situation, the guy said, okay, I can't help it, I'm having a panic attack. And if you're treating phobic patients, you know that they have tried a lot of things, and they know it's exaggerated, they know it might not happen, but they are always feeling these anxious things, and they're avoiding things. Someone said when the amygdala is on, it's over. You cannot turn it on, and the fear is here, and it's very difficult to move on. So what we could make under psychedelic, we could have this violation of expectation. And it's really the idea that if I go in an anxiety-provoking situation under psychedelic, I'm going to feel that. It's absolutely different from what I usually feel. So everything that I felt normally is going to be different. And one of the other things that works, it's also the occasionally reinforcing extinctions. Like, you also have to vary the fear, because if it's always the same things, you're not going to adapt. And as we said, and as we saw with Abigail, side effect is that your fear can grow higher, even you can get traumatized. We don't want this, but obviously if you're in a situation that is more frightful than the normal way, it might also help for exposition. So for example, if you are in an anxiety-provoking situation under psychedelics and you have a very intense situation, you can admit that the next time you go in this situation, you're going to feel safer, saying, okay, there's no zombie, everything's fine. One of the things that people are doing most of the time when they expose themselves, they have safety signals. I'm okay to go in this elevator, but my telephone has to be on, I have to call someone, or I need to have my pills on me, or I need to do this secret prayer, things like that, like in OCDs. And once again, under psychedelics, people would say, okay, do I really need all this medication? Do I really need someone with me, and so on? And what is also very important in exposure therapy is changing the context. What is good is that we can have globalization. We don't have to expose people to every elevator in the city, but it's also good to change the context. And under psychedelic, the experience is different from time to time. So, of course, we can use the same elevator, but having different experience. So, for example, the variability of context, I feel I'm not in the same place as last time. And also, what you need is recovery clues, and that was shown before for PTSD. You have to think, oh, when I re-experience this, it's completely different. And of course, the people will remember, okay, when I was in this anxiety-provoking situation under psychedelic, I remember how different it was under psychedelic. And all the other specific psychedelic experience might be useful for also alternative exposition feelings, like noetic feelings, ego dissolution, experience of unity, blissful state. I mean, if you have a mystical experience in an elevator, might help you to get in once again. Okay, yeah. But I think what is also very interesting here is the time perception alteration, because there is a big debate on how long you should expose yourself. Some people says until the fear is completely down. Some say you have to stay 10 minutes in it. And also, it's very interesting to see that people have this perception of time when they say, okay, the experience lasted for 30 minutes, and I know I just listened to this music for 2 minutes. So if the people have the impression that they have stayed long enough in an environment, that might help as well. Okay, this is all theory, but is it working in the reality? And I'm going to show a clinical case of someone who had a phobia and a general anxiety disorder. As it was said before, this case is not in a clinical trial, but this case is because we can do compassionate use of psychedelic in Switzerland. So this case had to go through all the BAG, the official letter to the administration to get the authorization for the treatment, but we could have it. So I was a 42-year-old man. He was in a relationship, no children, and he was describing a disabling generalized anxiety disorder, and his main symptoms was claustrophobia, mainly all the closed space, elevator, airplane, but he has also feelings of being locked into himself. He had problems with his jaw. He had feelings that he couldn't eat, that everything was blocked. It started since he was a kid, and he hasn't found any particular triggers. his father was a doctor and was trying to help him, and he had a lot of unsuccessful classic psychotherapy and treatment attempt. And obviously for anxious people, it's difficult to start therapy and expose themselves. And also what was an indication for starting psychedelic assisted psychotherapy, that he was refractory to conventional medication. He tried to take normal antidepressant, but as someone who is phobic to be locked in his jaw, he was really afraid of side effects and things like that. Fortunately, he wasn't afraid of psychedelics. I think his dad was speaking with him, and he was okay to do that. So normally in Geneva, we do some classical therapy, meaning we prepare the people for a few sessions, and then they come the day of the session, and during the session, we do some normal sitting session with a nurse who is there for the whole trip, and the doctor who can come, and the morning after, we do integration session, and afterward we do amplification session, so it's the normal process of psychotherapy. And at the beginning, I proposed this kind of treatment for this patient, but, sorry? On amplification, the treatment session is, we have a few sessions of preparation, of course. Then the day of the session, the people, they stay in the session, and we don't do psychotherapy, but they come the morning after. And then we do 1 hour psychotherapy to go through the session, how we lived it, how it was, and this is recorded and given to the patient, okay? So that was meant to be, but then speaking about with the patient, we agreed that we might try to do exposure therapy under psychedelic, and he was okay to try it. But obviously we decided not to do it on the first session because we had no clue on what it could make. So we had some sort of normal first session with no exposure. I actually proposed to the patient trying to do exposure therapy the morning after, but you'll see decided not to do, so we had a session with psilocybin, so we just accompanied, and I'm going to present the results of those 3 sessions. One of the things that is shown in literature is also the more you have an experience, the more it's going to be useful. So we had the mystical experience questionnaire, the MEC, and this is how he reacted during the session. The maximum could be 150 points. I actually don't like the title of this questionnaire because it's not only mystical experience, but it's a lot of experience. And I'm going to show you more in detail what he answered for a few questions, like for example in session 3. And as I said, I think that is very interesting for the treatment. He has 5 out of 5 loss of usual sense of time, loss of awareness where you are. He had no unity experience with object, people, and the environment, so elevator didn't become his best friend. But he felt humility. He had this feeling of being difficult to communicate about the experience, and he felt being at a spiritual level. What we are also monitoring is the effect during the session, and we ask about, at the beginning, every 30 minutes, how the people feel, and then we do that during the whole session. And this was the first session. As you can see, the red is the good effect, and the green is bad effect. We should choose other color, but it's like that. And I like the feeling. So you can see that he wasn't that anxious. He had pretty much good effect, and that could help also to do exposure therapy. So in the first session, we didn't do any specific exposure, but in the integration session, the morning after, the patient exposed himself in imagination, and he was revisiting the moment where he was in a plane, and that was the moment where he was the more anxious. And normally when he's anxious, he feels some electric current that usually runs through him. And when he did that in imagination, he felt things really, really differently. And, well, I haven't said that. This guy is an accountant, so it has something to do maybe in his job. He was feeling like being in a huge office and feeling binders. And the sensation was, I'm feeling my problems. It's fun and satisfying. I think you have seen that people have the feeling of doing meaningful things, and that was one of his experience. So I wanted to propose him the day after some exposure therapy, but he wasn't ready for it. But he was ready to start traditional treatment. So I have to say that in Geneva Hospital, we don't do the whole treatment. Normally, the people, they have a private psychiatrist, and this patient was okay to start conventional exposure therapy with him. So at the second session, we started to do exposure, and we decided, and I think it was a good idea, to do exposure before giving him psilocybin. So we started exposure in an elevator. So he went one floor with me, then alone, and he had what he said typical anxiety. It was 6 out of 10, fear of getting stuck. He had all the physical signs of being anxious. And what we decided before is that he's going to take the psilocybin, and I'm going to go through him and ask him if he feels ready to try to do exposure therapy under psilocybin. But we didn't say we're going to force him, because obviously if he's in a bad state, we don't want to expose himself to something bad. So he took 25 milligram of psilocybin, which is we'll say the normal dose at around 9 o'clock. And exposures started at 10:30. So when I went to see him, it was okay to do exposure therapy. He describes himself under the effect of psilocybin. He had this impression of disinhibition, feeling energetic, but he had no main alteration of visual perception. So I think it was the perfect timing to start the treatment. And then he made the first accompanied round trip in the elevator, and his anxiety was measured at 2 out of 10. And then at his request, he made a round trip alone from the first floor to the 7th floor, and the maximum anxiety was 2 out of 10. My anxiety was 10 out of 10 to let him, you know, alone in an elevator, but he succeeded it, so I was quite happy. So we did exposure again at 11:20. When he described himself at the peak of the psychedelic effects, and he wanted really to have exposure. And at this time, his anxiety was 0 out of 10, and we did another exposition, and he felt some short moment of anxiety with some sort of spikes, but that didn't prevent him of going into the elevator. So the morning after, we did this integration session, the second one. So here you can see this is before and then during the 2 exposition. So this is the first time when he was in the elevator. So he had really some effect, was pretty good. And this is when he was at the peak. He also described it, some really good effect. And maybe it's lucky to have that, but he had 0 anxiety at this time, or 0 bad effect. So during integration session 2, he highlights the fact that he was able to benefit from the exposure treatment while being under the effect of psilocybin. And what it was really interesting is that he faced the situation with less anxiety, and he was feeling that he could be able to continue this way. And well, it's only supposition, but we can think that, you know, a psychedelic reopened the learning process, and it's actually what he was feeling. I don't know if it's really that, but he was feeling no longer afraid, but he was really feeling like a novice who must learn, and he was kind of angry to start to expose himself again, and he says he was happy with his next challenge. What is important to say that we were working with a psychiatrist, and then sessions were quite long apart, and during the, when he was not in session, he was doing normal exposure therapy with his psychiatrist. And we did a third session. The patient asked to have a higher dose, so he was definitely not afraid of the effect of psychedelics. So we started with 35 milligrams, and we did always the same protocol, and he was really not afraid of exposure. So anxiety before was 0 out of 10, and when he did also this exposure alone and with me, and anxiety was completely gone. So the morning, it's too good to be true, but it was true. And the morning after, and I think that's really interesting because he chose this higher dose, and he said, you know, the experience in this session was very intense. Everything was going very fast. It's an experience to pass. And he was telling me that in the elevator had to deal with something much more significant than claustrophobia. He couldn't describe it, but it was this intense experience you can have under psychedelics. He described it at his best on going through a big storm. But really here, he was feeling that this sensation, this feeling was much stronger than just being in an elevator. And he said, I'm glad I did it. After all the session, he felt a bit exhausted, as if he had to climb a mountain, but he has also a feeling of humility, and he was thinking that good things were happened to him. To monitor the fear, we did a few scales. We had the fear questionnaire. So at baseline, it was really he had a lot of phobia, but the main one was claustrophobia. That's also why we choose the elevator, because it was more practical. And he was avoiding a lot. He was suffering from it, and he had a lot of discomfort. As you can see, during the treatment, things were going lower. And as many patients who have also general anxiety disorder, he was depressed. So here you can see that both the depression scale and the anxiety scale went down. So what can we say about that? Well, we have to be very humble, obviously, because it's one patient, but I think it's already a proof of feasibility. In the outer world, everyone is exposing himself under psychedelic. I mean, if you take psychedelic widely and you go in a concert or whatever, you're exposed to be in an environment under other circumstances, but here is in a controlled environment with a normal exposure therapy protocol. So it was accepted by the patient who wanted to do it again and prolong the experience. Had the chance of having no side effect with this patient, and the results was convincing. Of course, there is a lot of limitation. I mean, of course, positive results might be related to other parameters, but I think it's also working in parallel of the normal treatment. And the patient accepted to take SSRI, and he was taking SSRI under the exposure therapy. As you know, some studies show that you can take antidepressant and having the effect of psychedelics. So he was happy to take the medication. He was okay to take it. And obviously it was one case. And what might be the main limitation is that, as I said, he was okay to take psychedelics, so he had a favorable choice for it. But most of the anxious patients, they're really afraid. And they have read about side effects, and their fear is to die, to lose control, and things like that. So I think preparation is really, really important for that. So that's it. Any questions?
So everybody, we do what we've been doing since the start. We have these 2 microphones, and so who wants to go first?
What?
Un, deux. Merci, oui, vous m'entendez? Merci, c'était super intéressant. Thank you so much. It was so much interesting. I was wondering, you said it was one case, like this exposure test you expose us.
Yeah.
You just have one case,
yes,
right?
Yes.
Okay.
We are starting to do other cases, but
okay.
It could be really good to have a double-blind control study.
Course.
Double-blind. It's going to be difficult to do it double-blind, but one side should have no exposure therapy in the psychedelics, and the other arm should be exposed.
Ah, yes, you mean, yes, with the same kind of fear, I imagine, perhaps.
For example,
For example, okay. And do you think it could be any risk of addiction in this kind of specific of, like, okay, well, I didn't felt any fear because I was under the effects of psychedelic, and if I have not the psychedelic, it will,
okay.
I mean, like...
That the people would like to take psychedelic every time they go in a feared situation.
I mean, like, yes, exaggerating.
No, I don't think so, because for all the people who are doing this, they say it's really exhausting, and they say, okay, it's a big experience, but I don't want to redo it. And obviously this is because it's not working on the dopamine side, and it's more on the serotonin. So no, and obviously this patient afterwards, he didn't tell me I want to go next week in the elevator. He said, okay, now we stop for a few months or a few weeks. I go to see my psychiatrist, and then I want to come back, but it's really exhausting.
Okay, so what you are saying that you don't know now on the long-term effects, if now he is okay?
I know that, and he's okay. And
I mean, like, he is able to go in a lift?
He is able to go in an elevator, is able to go in a plane, continue normal exposure therapy. But I think it really opened something. Ça a débloqué quelque chose, and for him it was a success, I can say.
It looks like a very... ça a l'air d'être une pratique très prometteuse.
On espère.
Merci.
Do you think that this therapy can help with people who have hereditary fears?
Hereditary fears?
Yes.
Like what, for example?
Like, I know someone who has, when they see like holes, they get,
I think, yes, it might be useful for every fear, because obviously transform, you see the frightful situation. So I would say, once again, it's not for every patient, every fear, but there's no reason that some specific fear are being better cured than other. I mean, then it might be also more difficult to do exposure therapy under psychedelics for some specific fear. Obviously, I haven't taken any psilocybin to work on my fear of speaking in public, but you don't want to propose that, for example. Or you can propose it, but it's going to be another challenge. Why not? Yeah.
Hello. Thank you for this amazing presentation. And, well, I am aware that in the beginning of your presentation you said that beta blockers would not treat the source of the problem, of the fear. But for this specific situation, for the elevator and everything, do you think that if the participant would be comfortable enough to be exposed to that experience, only inhibiting the physiological parts of the fear, beta blockers would be able to replace psilocybin, for example?
If beta blockers can be as effective as psilocybin?
For this specific kind of exposure treatment?
Well, some people says if they are really afraid only of their physical symptoms, it can be useful. And there's literature telling the people who are afraid of having heart attacks and things like that, when they feel that the heartbeat stays steady, they overcome the fear. But the people who are afraid of being blocked, you know, they have some exaggerated thinking of, you know, like, for example, dying or being blocked. This won't change. So I think beta blockers might be one of the treatment, but psychedelics give you this change in a better spectrum of things. Huh? You have change in the way you see things, the way you feel, and so on.
Thank you.
You're welcome.
One more question. Okay.
Thank you. Thank you so much for your talk. I would like to ask a question more from cognitive, computational, maybe, if you will, side of cognitive behavioral therapy. So you have mentioned exploration, exploitation approach to learning when we are talking about exposure therapy. So I would ask if, are you planning to use any reinforcement learning approaches to model actually the behavioral aspect which happens from the cognitive side, not only from the physiological side? For example, some predictive coding approaches. Yeah.
Some what, sorry?
Predictive coding approaches.
Predictive coding approach.
Yeah, this is about how people generally update their...
Yeah. Mm-hmm. Yeah. I think they do it kind of automatically, because I think what is interesting that they can code something and they can expect something, because the results is so different. We have this big effect of violation of expectation, and they says, okay, it's completely different. So I don't think it really answers the question, but because we're dealing on another level, we have this completely different reaction, and they think this trouble the coding for the best.
Okay, I see. Thank you.
Welcome.
I think we can take a few more questions.
Oui, merci beaucoup pour la présentation. Thank you very much for the presentation. I'm a psychiatrist and I have a lot of patients. They are under SSRI. And my question is, are there some interaction between SSRI and psychedelics? Mm-hmm. Psilocybin, maybe not, but MDMA or other psychedelics. Mm. My question is, est-ce qu'il y a un danger en fait?
Is there danger to have antidepressant and psychedelic at the same time? Well, there might be side effect and interaction. We have to think about several side effects. One of the side effects is just the antidepressant blocking the effect of psychedelics, so you have no effect. And for example, Remeron or Tritico can do that because they act on the 5-HT2 receptors. And you can also have side effect with ancient antidepressant like imipramine, trimipramine, but we don't use it. So you have to be careful for every medication and see before. But what is interesting is that with the normal SSRI, like Cipralex or things like that, study in normal population shows that they have the psychedelic effect, and it's not changed by the antidepressant. But it's case by case.
Thank you very much.
more.
Have you considered other compounds like MDMA and ketamine? And if so, what made you choose psilocybin over those other compounds?
Yes, well, there's a practical choice because in our department we choose to work with LSD and psilocybin. So it's not clinically rational, but we wanted to have the pure psychedelic. I think ketamine, for example, might reduce the experience, and I would not expose someone under ketamine because you will be not so aware of the surrounding. But once again, it's an empirical thought. So, of course, maybe MDMA would work because if it reduces the fear or it makes you more accepted by others, we can imagine that social phobia can be better cured by MDMA. But supposition again.
Thank you.
Okay, let's just take one last question, and then if there is one, I think there's one over there.
Thank you for your talk. It was really interesting. I have a question regarding the definition of phobia, because if you take the psychoanalytic definition, then phobia has a specific meaning, and if you do not understand this meaning, then you do not really dampen the really phobia. So do you think with psilocybin, can the phobia shift to another object?
That's the fear of shifting from one object to another. Might be, but then we also have to see the pragmatical things. And for this guy, it was really not being able to be in elevators, planes. So, of course, people that have a general anxiety disorder, they're not going to be cured magically, and they're going to continue to have some fear. And this patient stays anxious about a few things, but on a functional level, it really helps him. But yes, it can.
Okay, thank you so much.
Okay.
Merci beaucoup.
I wanted to
et
thank
bonne
you very
suite.
much. Yeah. I wanted to thank you very much, Dr. Gabriel Thorens. Merci beaucoup.
Merci.